Now we are looking at how the body breaks. We are covering PA 12.2 and PA 12.3, the pathology of malnutrition, vitamins, and obesity. These aren't just diet plans, these are devastating cellular failures. Let's see what happens when the body gets too little or too much. Here's our pathology roadmap. Pathology is the bridge between basic science and clinical medicine. Today we explore 3 ways the body fails. Malnutrition, the starvation spectrum, specifically Marasmus versus Kwashiorkor. Vitamins, the missing structural pieces. What happens when the building blocks are missing? And obesity, the hormonal trap. Why fat is more than just weight. Let's start with failure number 1. Marasmus. I want you to think of this as the total bankruptcy. Look at the checklist. Low calories plus low protein, the tank is empty. Somatic and visceral depletion, everything is gone. Result, muscle and fat breakdown. The appearance is classic skin and bones. This is the concept you need to grasp. The body burns its own furniture to keep the house warm. It eats its own muscle to survive. Now the big question arises, why is there no edema? Read the box. The body is smart. It maintains just enough albumin to keep water in the vessels. It prioritizes blood volume over muscle mass. Now contrast that with Kwashiorkor. The name literally means the displaced child. The cause? Look at the text. A child is weaned from protein, that is the mother's milk, to carbs or starch because a new sibling has arrived. They are getting calories but zero protein. This leads to albumin magnet mechanism. Without protein, the liver can't make albumin, so water leaks out, hence the swelling versus wasting in marasmus. Now let's talk about liver and skin pathology in Kwashiorkor. Fatty liver. The liver makes fat, but it needs protein to build boats or lipoproteins to ship the fat. No protein means no boats. The fat gets stuck in the liver, causing fatty liver. Skin. That is flaky paint dermatitis. The skin peels off because it lacks the protein to stay strong. We have talked about the fuel, calories and protein. Now let's talk about the machinery. Let's look at the vitamins. First, vitamin C. I call this the glue. Why? Because vitamin C is required to make collagen. Without it, your body literally unzips. Look at the clinical features on the slide. Bleeding gums, because the vessel walls are weak. Old wounds reopen. This is terrifying. Healed scars fall apart because the collagen fails. Bone pain, from bleeding under the periosteum. Next is the high-yield exam topic, vitamin D, the calcium bus driver. Look at the diagram. Gut, the calcium is waiting to be absorbed. Bus, vitamin D picks it up. And the bone, vitamin D drops it off. What happens if there is no driver? The text says, deficiency means calcium never reaches the bone. In children, it manifests as rickets. The bones become soft and rubbery. Look at the specific sign mentioned, rachitic rosary. This is the overgrowth of rib cartilage that feels like beads under the skin. Finally, we move to obesity, PA 12.3. I call this the biological trap. Here's the big question. Why is weight loss so hard? Is it just willpower? No. It's a hormonal failure. Let's see why the body fights against weight loss. This is the mechanism you must know, the leptin feedback loop. On the left side you see normal physiology. The fat cells releases leptin. It tells the brain stop eating. Simple. And on the right side you see obesity pathology. We have high leptin. The fat cells are screaming, but look at the brain, resistance. The trap. Read the bottom box with me. Despite high fat stores, the resistant brain thinks the body is starving. The brain screams, I'm starving, eat more, even though the body is full of energy. Alright, let's wrap this up with your exam checklist. Before you walk into the exam hall, make sure you can do these 3 things. Draw the emphysema seesaw, the protease-antiprotease balance, memorize the Marasmus versus Kwashiorkor table, and identify Mallory-Denk bodies on microscopy. You have the roadmap, now go conquer the exam. See you next time. I've created a high-yield PDF cheat sheet of all these tables and flowcharts. The link is in the description. Good luck studying.